Today, we're going to talk about an itemized list of how Multnomah County, it's the city that Portland's in, spent $84,000 on smoking supplies. Harm reduction, or as we refer to it as harm production, because all harm, no reduction. It's what we're doing. Right? That's literally what you've got going. When the mayor of Portland, Mayor Ted Wheeler, comes right out and says, I don't think this is the best use of our resources. That's when you know things are upside down. He basically did a big pushback, and all this money that was going to be spent by harm reduction in Portland, in Multnomah County, it basically got stopped in its tracks. It had enough people that said, no. Because what's happened is, well, let's get into it and we'll talk about it. How about that? How about we do a podcast on it? Here we go. So essentially what happened is Portland has always been a big harm reduction area, right? Here's your clean needle so that when you shoot up your heroin, you don't get hepatitis C or whatever it is. You don't get, some transferable disease by hypo. Okay. Yeah, that makes sense. But that has kind of gone away because everybody's smoking the fetty, right? They're smoking the fentanyl and there's no needles. So, harm reduction, their thing is, well, we're just trying to bring people with the clean needles. We're just trying to bring people in so we can get in front of them. And then we can really, get to talking to them and maybe get them into treatment. But, we also don't want them to get hepatitis because, an overdose versus hepatitis. So the whole smoking, the handing out basically pipes and tinfoil, what harm does that reduce? I mean, literally, you're just enabling people wildly to do drugs that are the number one cause of death for people between the ages of 18 to 25 in the United States. And you're just saying, here you go, kill yourself a little bit more. Take that shot, take that risk that whatever drugs you're smoking up here might have enough of a dose in it that's going to kill you. Right? I mean, this is literally what we're doing. So even in a town like Portland, there's enough pushback where they're like, you know what, handing all this stuff out, you know what? We're really tapped out here. We can't really work our way through. And so they basically said, no, we're not doing that. But now we're going to read about how much money on tinfoil they spent. Multnomah County Health Department has provided an itemized list of its controversial purchase of $84,212.93 in smoking supplies, including 31,000 straws to smoke with, right? 90,000 sheets of tinfoil. 90,000 sheets of tinfoil and more than 55,000 pipes, which it planned to begin handing out to local drug users in July. The thing that kills me about this is people say, well, based on the evidence that we know to be true, harm reduction works. And all I can think of is not with fentanyl. You take one blast of that and it's too loaded up and you're done. Like what probably happened to my son. We officially don't know the cause of death for my son. And, that's just something that's really hard for a father to kind of work out, in your mind. It really tweaks the whole grieving process because you're like, okay, did that happen? What really happened? Oh man. Now, I miss my kid terribly. And so if there's, people handing out supplies to do more drugs, I am a hard no-go. Those resources should be spent on getting people into treatment, period. And I know the harm reduction people talk about, well, this is how they start to do it. But in all those programs where they hand stuff out, San Francisco's Tenderloin being the excellent example of all the people they had come through for clean needles, I think 23,000 people came for services and 3 or 4 of them went into treatment. All right. If it saves one life, then it's worth it. But people are basically just getting free needles, which cost money. No doubt about it. But tinfoil And you're handing out tinfoil? What kind of harm? How are you reducing that there? Because you don't really get anything from smoking drugs off of tinfoil, right? I mean, it's not like you're shoving a dirty needle into your system. Some of the new trank that's not new. It's been in Philadelphia for a long time, but the trank dope is steadily finding its way into San Francisco. And then there's another kind of fentanyl, fentanyl. It's supposed to be 5 times stronger than regular fentanyl. Just some nasty stuff. Nasty people dealing nasty stuff. Public pushback regarding the highly publicized plan caused county officials to temporarily suspend the policy on the grounds that it didn't follow proper implementation protocols. Nah, I think it was just, it's such bad optics to be handing out 55,000 pipes, 31,000 straws, and 90,000 sheets of tinfoil. It's just absolutely insane. Now we're going to try and help some people here. Really? That doesn't seem like help. That seems like you're hurting them. Maybe killing them. How many pieces of those 90,000 sheets of tinfoil are going to kill people? I mean, realistically. So you've got the county enabling people to take the drugs that are the number one killer in the United States right now. Does that make any sense at all to you? Certainly doesn't to me. At all. But then, you hear harm reduction people talk, and their whole theory is some people may never, get off the dope. They may never get off the drugs. And so we believe people should have the option to just do it all day long. That's how you get to a position where you're like, 55,000 pipes, 31,000 straws, and 90,000 sheets of tinfoil. It's all good. It's all good. However, Multnomah County Health spokesperson Sarah Dean told Coin 6 News that the plan, which used surplus funding from the county's syringe budget, when you've got a syringe budget, that's just so backwards. You know what I mean? Yeah. Syringe budget to accommodate changing preferences in drug use. Nobody's doing the heroin anymore. It's all tinfoil. It was outlined before county commissioners during a May work session, and the word kind of got out. And it was just this big outrage. And when I heard about it, I recorded the podcast. And by the time we were about ready to release the podcast, the plan had been stopped, and they basically said, okay, yeah, we're going to temporarily hold off on this. So the board holds these public work sessions ahead of approving a final budget, which they did ahead of the fiscal year, Dean said. Board members often use these meetings to ask detailed, pragmatic questions. All board members serving in May were in attendance during this portion of the work session when the health department shared their plans. And people are like, I'm not seeing the benefit here. Sarah Nelson, one of our city council members, literally, and I did a podcast on this, and I was just showing the literal idiocy of our Seattle public health officials. And I came right out and said, yeah, they probably haven't had a kid die from smoking fentanyl or whatever it was that killed my son. They probably haven't had a kid that's done that, because if they had, they would realize what a bad idea all this harm reduction is. And that emphasis should be putting on getting people the help that they need, even if they don't want it. That's reality, right? Regardless of the Board of Commissioners' current stance on the policy, the money is spent and the supplies are delivered. Oh, that's good to know. That's good to know. There's some storage locker out there with, 85 cases of tinfoil. The itemized list of expenses obtained by Coin 6 News shows that most of the aforementioned funds were spent on 55,404 smoking pipes. The varying number of stem, bubble, hammer, and meth pipes cost the county $42,966. Stem, bubble, hammer, and meth pipes. This is what Multnomah County is spending taxpayers' money on. Stem, bubble, hammer, and meth pipes. And they're going to hand them out. Here you go. Do some drugs. Hope this works out for you. That seem like a good game plan to you? Yeah. Me neither. It's absolutely insane, right? Other major expenses from the order include $21,613 spent on $184,000 copper scouring pads and brass screens used as pipe filters. Why don't we just give them some drugs while we're at it? Just load it all up. Just give it to them, right? You might as well at this point. $7,250 worth of aluminum foil and $6,820 spent on rubber mouthpieces used to prevent the spread of bloodborne illness and surface germs when sharing pipes. So high probability people could die smoking the fentanyl, right? And you're worried about bloodborne illness or surface germs while sharing. Somebody might get a little sick. They might get the flu. And you're giving them something that could kill them? Doesn't make a lot of sense to me, but that's just me. That's just me. Okay. The brass screens. I get it. This is all stuff that you use to do drugs. It doesn't mean the county needs to be giving it out to its residents. So backwards. It's so upside down. The county health department also attempted to spend $30,000 on 1,700 cases of chapstick to further prevent the spread of bloodborne illness among drug users. Chapstick. Talk about chapstick. 1,700 cases of chapstick. Who came up with that? We don't want cracked lips here. People dying? Well, you're going to have some of that. You're going to have an odds based of, 6-7% of these people that are going to take a hit off this boil are going to die. All right? Whatever the numbers are, I don't know. But hey, let's make sure that their lips aren't chapped. Right? In a $5 educational pamphlet on boofing, written by social activist Ceci Blanchard, titled A Harm Reduction Guide for Boofing. That is the holy act of putting drugs up your behind. Boofing. Boofing. You're going to get a pamphlet on boofing. What else do you even say? Boofing. People have different ways they use drugs, including introducing drugs through veins. All right, we got veins, we got swallowing. Yeah, you take a pill and breathing in. All right, yeah, you vaporized it and you breathe it in, you smoke it, snorting it, or applying to other mucous membranes, such as gums or rectum. Yeah. Put it where the sun don't shine. It's apparently supposed to be very effective because you are bypassing the GI tract, the gastrointestinal tract. Yeah. Okay. Hey, I remember in Seattle when Harm Production was handing out the booty bump kits. Jason Ransted, he had a pretty good article, and it was the flyer was literally, I just remember a clip off the flyers like, hey, if your veins are all worn and tired out from all that drug use, don't collapse them. Don't make them go totally ineffective. Put it up your butt. Boofing. All methods of drug use can cause injury, elevate risk for infectious disease, and cause cross-contamination and or exposure to a drug they did not intend to ingest. Harm reduction can reduce these harmful outcomes. Here's where that breaks down. When just one hit kills you, right? Kills you. So that this whole thing with the drugs we have now, it does not make sense. And nobody that is getting in front of these harm reduction people, nobody's voluntarily going into treatment because these drugs are so strong and these addictions are so strong. That's why we see so many people in the homeless encampments. I shouldn't say nobody. I shouldn't say absolutely nobody. Vast majority of folks that are on these drugs will not get off on their own. They will not detox on their own because it's such a horrific experience. The stuff is so strong and it's got such an addictive component to it that's why they will do anything and they will steal. They don't care. And, when we're not incarcerating people or we're not, because you will read a lot about folks saying, hey, It was my last stint in jail. I finally got clean. I made it out. I'm making something of myself. But without that last arrest and that 3 months in jail, I'd be dead. So there is something to say about incarceration, because a lot of folks don't have the ability to get off on it. Most folks don't have the ability to get off on their own because it's such a brutal detox. Their body is just screaming out, give me the drugs. And, here's Multnomah County saying, here you go. Go ahead, do some more. Now, don't get chapped lips. Don't want that. Don't forget the boofing. Don't forget the boofing. Boofing's an option. So gross. Coin 6 will continue to follow the county's decisions regarding the distribution of smoking supplies as the story develops. And if you really want to go through some mind-numbing numbers, you can check out there's a PDF graph. See the Multnomah County Health Department's full order sheet for the smoking supplies in the documents below. The fact that this is a thing, I mean, it always kills me that they're going to hand out a bunch of things that are literally killing people. Now, back in the day, I call it, this is not your daddy's heroin. You had overdoses, but man, they were rare relative to the number of people doing the drugs. Now, I mean, it's literally the number one killer, right? And so is it appropriate to be handing out foil? Is it appropriate to be handing out all this stuff that enables this? I'm a hard no-go. That money literally should be spent on addiction care centers, all of that, instead of just, hey, here, here's a piece of tin foil, and surprised they don't hand out Bic lighters. Why aren't they handing that out? Because it's flammable. There's probably some ordinance on, you can't hand out flammable, but you can hand out a boofing kit. Don't forget your boofing. Don't forget boofing is an option. I mean, this is coming from a governmental entity. That is how you get so screwed up. Somebody sat around in a committee and said, this is a good idea. Hey, you know what? We are recognizing that more people are doing less people are doing heroin, and they've moved that on to the much cheaper, much more powerful fentanyl. So we need to change up our harm reduction in the meantime. It's like, okay. What a bunch of knuckleheads. That's what I have to say to that. You might disagree with me on the whole harm reduction and how many lives it saves. But if you're putting people in front of a drug that can kill them on any given dose, I'd say the responsible thing to do is try and get those people the help they need. But state of Oregon is one of the worst states to try and get people either mental health care or addiction services. Just wildly underfunded, just not what we're doing. And, for so many of these folks, I see one way out, and that's they end up dying. That's kind of what I see happening, because they're not going to go into treatment. Nobody's going to force them into treatment. What do you say to that? And the stuff is so addictive that, people just get hooked on it like that. I mean, it's nasty. It's a slippery slope. People do one pill and boom, they're on it. They're like, this is some good stuff. It is. It's super strong. It's way more powerful than your daddy's heroin. 50 times, 100 times stronger. And it's cheap. $2 a shot, $2 a pill, $2 a dose, whatever you want to call it. And that's on the cheap end. And I recognize that. That's in cities where you've got massive supply, but Portland is one of those. Seattle's got quite a supply as well. So yeah, those are the numbers. Those are the crazy numbers on what Multnomah County has spent. This money has been spent. And, there's a little bit of an uproar, but guaranteed behind the scenes, they start handing this stuff out. They'll go to the encampments because in their minds, they believe, okay, if we hand out this tinfoil, somebody might come to us and say, hey, we're ready for treatment. And then we can get them that help. Yeah. But in the meantime, you're just encouraging people to do something incredibly dangerous based on the odds that could terminate their lives. Don't worry about the whatever germs they might get in their mouth. Don't worry about their cracked lips. Worry about them having a massive overdose that's going to need Narcan. And if nobody's there to administer it, they're dead. They're dead just like that. So, a little bit of germs versus dead. Cracked lips versus dead. Those are pretty easy things for me to quantify. But I also come to it from a very different perspective, and that's having my offspring die from probable drug overdose. So there you go, right? There you have it. So that's what Multnomah County has spent. Whether it gets distributed, I guarantee it's Multnomah County. Why wouldn't it? Now we're just going to archive that. We're going to have a big hot dog festival, and we'll need to use up to 90,000 sheets of tinfoil. I don't even know how does that even make sense with hot dog? I don't even know. What do you do with 90,000 sheets of tinfoil? I have no idea. I've got like a couple on my boat because, you use them to keep things temporarily warm or cover it up. You don't want to use plastic. It's a lot of tinfoil, right? Lot of tinfoil to smoke a lot of Fetty. All right. That's it for me. Stay reasonable. Check out our merch, all that good stuff. Make sure you hit the subscribe button. I haven't said that in a while. I just don't say that anymore because tons of people have been subscribing. Thank you so much. We're going through a little bit of a summer slowdown, but that's pretty normal. Thanks so much for being here to this late stage of the game on this podcast. I'll catch up with you in the next one. Bye for now.